if it wasn't on your radar, it probably is more so now.
Well, that's Val Lawson. She's the new Senate president. The closure of Anchor Medical, leaving thousands of patients looking for a lifesaver, underscores the urgency of Rhode Island's primary care crisis.
So many people are sick and they just cannot find a doctor. It's an issue NBC 10 I-Team reporter Tamara Sakarsik has been investigating since 2022. And tonight she dives into what's being done to fix the problem.
Are you or any doctor working here accepting new patients?
No.
It's an answer being heard across Rhode Island as the state scrambles to address a shortage of primary care doctors spurred by low reimbursement rates and increasing job demands.
We keep loading more work on primary care doctors.
Former Rhode Island Health Department Director Dr. Michael Fine cites the burden of administrative tasks. According to a 2020 study, primary care doctors spend 66.5% of their time on direct patient care and 33.4% on other tasks.
Referrals and pre-authorizations and stuff with pharmacies and pharmaceutical benefit managers.
Docs end up doing the other stuff before hours, during lunch, after hours, after the kids are in bed.
A commitment that Dr. Yule Edgeness says isn't sustainable or attractive.
New doctors see this and many don't want a part of it.
Then there's the issue of reimbursement rates, an obstacle that Anchor Medical Associates cited when announcing its closure. Data obtained by the I-Team shows, on average, commercial insurance reimbursement rates are 29% higher in Massachusetts communities that border Rhode Island. Medicare and Medicaid reimbursements also higher over state lines. It puts Rhode Island at a disadvantage.
This just adds another layer, another reason why somebody might choose to practice in New London or in Attleboro as opposed to in Warwick.
New regulations implemented by the Rhode Island Health Insurance Commissioner aim to address lagging commercial reimbursement rates. In the next 4 years, private insurers must devote 10% of all medical spending on primary care instead of the current 6%. But Medicaid reimbursements largely fall on the legislature. Governor McKee is proposing a review of those rates, but that wouldn't be due until September of 2026. Is that soon enough?
No, probably not. And I mean, we need to continue to look at accelerating that.
Senate President Valerie Lawson says the Senate has rolled out several bills to combat the primary care crunch. One would end prior authorization requirements. Another would increase the availability of training programs. Then there's the idea of a new state medical school at URI.
We're hoping to get results before the end of this session so we can act upon it.
But doctors say quicker changes are also needed, including how doctors get paid.
Many of us have thought for years that we ought to move to a subscription or membership-based process.
It's already being done in Massachusetts. Instead of charging per visit, physicians are paid a fixed rate per patient per month under Mass Health.
We got to rethink how we're paying for primary care, first with Medicaid, then with commercial payers, and then see if we can make some progress with Medicare.
If we don't, Dr. Fine worries about the future of primary care in Rhode Island.
We got a bit of an emergency, and unless we roll up our sleeves and change what we need to change, this is only going to get worse.
Rhode Island needs roughly 300 primary care doctors right now. Until those spots are filled, finding a doctor will likely continue to be an issue. For the NBC 10 I-Team, I'm Tamara Sakarsik.